You should consult your physician or other healthcare professional before performing these tasks to determine if you're able to perform this level of activity safely. This is particularly true if you or your family have a history of high blood pressure or heart disease, or if you've ever experienced chest pain when exercising, or have experienced chest pain in the past month when not engaged in physical activity. If you smoke, have high cholesterol, are obese, or have joint problems that could be made worse by a change in physical activity. If you experience faintness, dizziness, pain, or shortness of breath at any time while performing these tasks, you should stop immediately. Stop immediately if anything is causing you pain.
There are many different types of Hoyer lifts. This one is the one that we will be using in this video demonstration. Before attempting to use the one that you have, make sure you familiarize yourself with all of its functions. Most of them will be very similar, and so we will go over the intricacies on this one. But there may be some differences between levers and places of things like that. Each Hoyer lift is going to have a different weight capacity as well. So just make sure that you know the weight capacity that it has and then use it accordingly. As previously stated, each Hoyer lift is going to have its own differences between different makes and models. This particular one has a 3-strap system, so it has 2 straps down by the legs, which will need to be crossed in order to keep the patient inside of it. And then it has 2 more pairs of strappings that go all the way up to the head and neck area. As you can see, the Hoyer lift can be swiveled and moved around like that. What we're looking at here is the braking system. So you have the locks that you can have on so the Hoyer lift does not move, and always make sure to have that when you are loading the patient in and out of it. This is going to be the lever that adjusts the arms of the Hoyer lift, and that's so it can get around wheelchairs, chairs, or even if you have things under the table, like a box or something like that, you can expand it and get around it and still have the legs go under the table. Moving up along this particular Hoyer lift, you now have the handles that you can grasp a hold of and use to move the actual entire lift, and that can be with or without the patient. What you see now is the hydraulic press that is used to lift the patient up off the bed or chair or what have you. Each one's going to be different. Some have automatic controls and others have lifts like this. If you turn this dial too quickly, the Hoyer lift is actually going to drop relatively quickly. So you want to familiarize yourself with the workings of your particular lift and make sure you know how much you need to twist the dial for releasing the pressure of the hydraulic so it actually drops. Or once again, if you have one that is automatic, it's just simply a button that you press that'll lower it down at a constant speed. You'll see here it is now being lowered at a speed that is appropriate for having a patient in it.
All right, now we'll take a walk through how to move a dependent patient using the Hoyer lift. So you want to make sure that you align them properly and have everything set in place before you move them. Then roll them to their side and have the harness ready. Depending on the harness that you have, you may have to roll them over and scrunch it underneath so that it works properly. With this harness, it's not necessary though. Once the patient is in place, then you want to make sure that you get the straps in the proper spots so that once you get the Hoyer lift over them, you can then lift them safely and comfortably. Make sure that you properly cross the leg harnesses so that it cradles the individual so that they don't slide out. Move the harness into position. Make sure that everything is locked so that the patient doesn't run away. Lower the harness, or the Hoyer lift rather, and make sure that the rings are in their proper alignment so that you have the patient sitting up properly instead of in a Trendelenburg position. Once the patient is properly strapped in, then go ahead and use the Hoyer lift to lift them up. Make sure that you have another individual supporting the neck, especially in cases of spinal cord injuries, so that no cervical neck injuries occur. Make sure that you lift up the individual high enough so that there's no contact with the surface that they were on. Then go ahead and unlock the wheels. Lift them up properly just to make sure. And then pull them out. You can then transfer them to any variety of seating devices. In this case, we're using a wheelchair. You want to make sure that you have all objects clear of the Hoyer lift so that you're able to attend to the client or patient as needed. You also want to make sure that the wheels are wide enough to go around the object that you're trying to place them in. Position the patient properly, and then with help of an assistant, slowly lower the patient down. Make sure that the wheelchair is locked so that the patient doesn't go sliding anywhere. From there, you want to unlatch and then make sure that all of the cords are out of the way. You can also, if they need adjusting, go underneath their arms from behind and use that maneuver to lift them up into the proper position. And like I said earlier, make sure that the cords are out of the way so that they don't get caught in any of the wheels. If they're in a wheelchair, make sure that you put leg rests on so that their legs don't drag or get caught in anything like that. Once again, position the cords properly. And once that's all set, you're good to go.
The transfer from the wheelchair to the mat will be the exact same thing that you have just completed, except in reverse. Notice the position of the legs of the Hoyer. They are wide enough to go around the wheelchair to let the actual Hoyer lift be in a good position to attach the straps to. Make sure that the straps are even from side to side and that the bottom straps where the legs are cross so the patient doesn't fall out of the lift. Adjust the straps as needed based on your Hoyer lift's recommendations. Depending on patient position, you want to make sure that the straps on the legs give a little bit less length than the straps on the torso and head and neck area. That way, optimal seated position will occur. Make sure you raise the patient out of the wheelchair or seat with help from someone behind, making sure that they do not just fall back. Once the patient is out of the wheelchair, you can rotate them in the Hoyer lift so they clear the obstacle and are in a better position to transfer onto the mat. Once again, making sure that someone is behind them, making sure that the patient stays steady and does not hit themselves on any of the equipment. Make sure the Hoyer lift is high enough so the patient completely clears the mat that they are going to. And then once they get to the mat, you can position them as needed and slowly lower the lift while positioning their feet and or torso in the place that you would like it to be. Once that is completed, you can go ahead and remove the straps and make sure as you lift the Hoyer lift out of the way, it does not bump the patient on the way up. Repositioning can be done once the Hoyer lift is removed.